Hello, good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, and tonight we're going to focus and zero in on stress, emails, social media, deadlines, politics, Roe versus Wade, gas prices, grocery prices, inflation, hiring competent staff in 2022, living in Southern California. I've had it. Now I feel better. Seriously, stress is rampant in today's world. We can't escape it. All of us are affected in one degree or another. So, we all want to change the world, right? We want to make it a better place. But that's a daunting, if not impossible, task. And I think all we really can do is change ourselves and our attitudes. And I think being an optimist that little by little we can change the world. But it's really about not just the stresses in life, but how we react to the stress. How Maya Angelou once said, if you don't like something, change it. If you can't change it, change your attitude. So let me define stress. This is kind of what I always like to define and make things straight out of Webster. But stress is a feeling of emotional or physical tension. It can come from any event or thought that makes you feel nervous, tense, angry. It's your body's reaction to a perceived threat. In short bursts, it can be positive, like if you're being chased by a saber-toothed tiger, something like that, or meeting a deadline. But most what we see in today's world is chronic stress of a chronic nature. There's 2 points I need to bring out. Number one, stress means different things for different people. Like your stress may be my motivating factor, okay? And there's also the difficulty in correlating stress with disease. Like, for example, I can tell you that if we decrease your blood pressure by X amount of points, we can decrease your risk of heart disease by this percent. And we can decrease your LDL cholesterol by this much. We'll be able to decrease your risk of heart disease. But we can't say that about stress because I don't know how much of a decrement in stress is going to lead to this much of an improvement in your cardiac health. We can't define it like that. So it's a normal part of life, right? And we all undergo stress, but if left unmanaged, it can lead to emotional, psychological, and physical problems, such as what I see as a cardiologist: heart disease, palpitations, chest pain. And how does the body respond to stress? You guessed it, it's fight or flight. So these chemicals, neurotransmitters, are secreted: epinephrine, norepinephrine, cortisol, and they play havoc. They play havoc on our system. So I'm going to give you an example. In my practice as a cardiologist, and many years of doing this, I see people come in all the time with palpitations and chest pain, and sometimes, of course, it can be the real thing, but in most cases, it's really not. There's really nothing really physically wrong. This is usually stress induced. But I have to work to the patients. I put them through various tests. And at the end, it's like, okay, these are the results. Now, what they're going to hear from their average physician is that, well, I got good news and bad news. Good news is that your heart's fine. All the tests are negative. Bad news, you got to live with it. Now, I don't know about you, but I don't want to live with stress or pain, whether it's a physical or emotional. So I'm going to do everything in my power to rid myself of that pain. And that's what we do, what I do as being the medical advocate. I teach people how to identify triggers, and also how to objectify their stress and how to breathe, the power of the breath, which we'll talk about a little bit later. So how can stress be a risk factor of heart disease? Well, high levels of stress can worsen other risk factors. For example, if you're highly stressed, you're probably going to eat not so great. You may be drinking more alcohol. You may be smoking more. You may be exercising less. And so these can result in an increase in blood pressure and worsening cholesterol and other risk factors. So know this: chronic stress exposes your body to unhealthy levels of chemicals. Again, norepinephrine, epinephrine, and cortisol. So I looked up all the common stressors that we see in life. Now, I mentioned the ones in 2022, but if you look at the standard stressors, there's like 13 of them, and they're all listed in my book. Illness, either personal family member or a close friend. Death of a friend or a loved one. Personal relationship problems. work overload, unemployment, a new job, unhappiness at a present job, retirement, relocation, legal issues, financial challenges, pregnancy, and perfectionism. At the time of my little minor heart attack, which I had, which you will read about in my book, I had 8 of those 13. 8. Not good. So, a little history. In 1988, the National Heart Foundation of Australia came out with a statement based on meta-analysis and so forth that stress really could not predict heart disease, but it could trigger an event such as a heart attack or a stroke, and it could influence other risk factors like hypertension, cholesterol, etc. That same group, 15 years later, concluded that there's a very strong relationship between depression as a risk factor for heart disease. And that association existed for both men and women and people living in different countries and in various age groups. So in 15 years, we learned that, oh, depression is really a serious thing. It's a risk factor for heart disease. And I outline in my book many case studies, many studies involving stress and how it can affect the heart. The studies are mixed with regard to cancer, but we do know that ongoing stress can definitely affect the progression of cancer, what we call metastasis. So one thing that I just want to leave you with, stress will clearly weaken our immune system, and that can lead to cancer and other things. So, I had a friend once that I interviewed for my book, person I went to high school with, may she rest in peace. And she said, when I came down with cancer, being a healthy person, I said, well, there's got to be a faulty immune system. She told me this like 14 years ago, and how right she was, because it's a recent study that came out right here in California, USC. They found that chronic stress accelerates the aging of the immune system. It may increase the risk of cancer, heart disease, and COVID-19 infections. No surprise, right? There's a term called immunosenescence. It's a relatively new word, and it refers to the natural decline in our immune system as we age. I mean, the biggest risk factor for diseases of aging is aging, getting older. And what happens is that as our immune system weakens, white blood cells that usually engulf bacteria and so forth and so on, they're not that effective, and we can't make enough new ones. The supply isn't so new. So it's really to do with our immune system. And in this study, the researchers set out to discover, well, why do some people exhibit more immunosenescence than others at the same age group? And they found out that people with higher stress scores actually had more signs of immunosenescence than those who don't. So again, stress does have a major role in the immune system and can really set us up with disease. So how do we manage stress? Well, first of all, let's just go one thing straight. Obsessing about the past and fearing the future does nothing. It's a total waste of energy. I've done it. It doesn't work. Um, and what's depression anyway? It's repressed anger as far as I'm concerned. So what I try to focus on is mindfulness training with my patients and with myself. And just about staying in the present moment. Because really that's all we're guaranteed, right? The present moment. We don't know what's going to happen tomorrow. So I try to really work on that when I start to feel stressed, and I inculcate that to my patients. And one of my favorite people, Jon Kabat-Zinn, if you ever get a chance, he's a wonderful psychologist, I think in University of Massachusetts. And I went to one of his seminars a few years ago, and it was amazing. He's amazing. He's worked with people with AIDS and chronic rheumatoid arthritis, all kinds of painful, horrible conditions. And he keeps them in the present moment. And to watch one of his videos is just awe-inspiring. And one of his tricks, I call it a trick, he passes out a raisin to everyone in the group. Little teeny raisin. Okay, we spend like 15 minutes on this raisin. We look at it, we touch it, and we feel it. Then we smell it. And then we bite into a little teeny piece. And then we bite into another little piece. And then finally we take the whole damn thing in our mouths and spend like 5 minutes chewing it. We spend like 15 minutes on this one raisin. Isn't that amazing? 15 minutes on just a raisin. And we're in the present moment. That's all you can do. So I love that. And I also teach people to objectify their stressors. You have to learn what leads to your stress. It's just not free floating. There's something happening, at least in most patients. And then I talk about meditation practice, which is essential. One thing I did leave out, activities. Okay, and one of my favorite videos that I did a few years ago was based on being in the present moment by doing things that you love. So I use myself as an example, and people that know me know that I am a bodybuilder. I used to compete. I love to dance, and I love to sing. Those are three things that I love to do. And when I'm doing those activities, there ain't no way I can think about stress when I'm lifting heavy weights, or when I'm dancing with Lisa Nanciala, or when I'm singing. I'm in the moment, and it's an incredible moment. So activities that you love is a great way to deflect stress. Like, my sister's a master bridge player. That's not my thing, but when you're playing bridge or chess, you're in the present moment. You can't be thinking about anything else. So it's finding activities that you love that will bring you in that present moment and keep you there, at least for a time being. Meditation. Okay, so it's essential that we all meditate on some level. And I start off people instructing them to take 10 deep breaths. We're going to go on the breath in a minute. 10 deep breaths. It will take about 30 seconds. So I had them do it first thing in the morning. They sit up in bed. They don't get out of bed yet, and they're propped up against the bedpost. They take 10 deep breaths, and they do the same thing before they go to bed at night, and before they shut the light. Okay, so that's 10 breaths in the morning and 10 breaths in the evening. That's 20 breaths, right? And then before a meal. Now, when you do that, especially before a meal, you're going to decrease the heart rate. You're going to decrease the respiratory rate. You're going to decrease the blood pressure, and you're probably going to eat less. It's just a great thing, right? So I want to end with how I teach breathing. There's lots of different breathing techniques, and I use a lot of them. And singing is called 𝗪𝘁. You actually use the power of the breath to stick your stomach out, which is not really politically correct, right? But you need to do it when you sing. When I'm working in the infrared sauna, I'm doing respiratory training. It's a whole different animal. But when I really want to relax and meditate, I have it's kind of a yoga breath, but here's how I do it. No, it's just my own way of doing it. So I count to myself to 4 if I breathe in through my nose. Then I hold the breath for a count of 2, saying to myself, 1001, 1002. Then I let it out on a count of 6. And why 6? Because we're always going to breathe in, right? We die. We have to take in oxygen. But we forget to breathe out. We forget to exhale fully. And when we get excited, we really forget to breathe out, to exhale fully. So what happens? We trap air in our lungs, and we start hyperventilating and getting on these uncomfortable feelings. So I really emphasize the exhalation because it's so important to slow the breath, the rate of the breathing down. So I'm going to demonstrate to you how I do it. So through the nose and hold for 2 and out for 6. And I put my teeth together because I do like a hissing sound because I like the audible cue. It's calming, and I think of it's like a tire deflating. I think of stress melting. So here we go. And do it with me. Okay? Go. Simple, right? In for 4, hold for 2, out for 6. You do that 10 times, you're going to be in a relaxed state. And you have to do it on a regular basis because it's like anything else. Use it or lose it. So that's how I deal with stress. I teach people how to do it. I teach breathing. So when you come to me, I'm not going to say, you have to learn to live with this. Who in the hell wants to live with pain, palpitations, chest pain? So I try to give people tools. And that's what happens when you become your own medical advocate. You have a toolbox, right, George? You pull out these tools as you need them. And being in the present moment and doing activities that you love and having a regular meditation practice is how you do it. Then you build up from there. I mean, I usually spend about 20 minutes every morning breathing, working on my breath. And then I spend about 5 minutes outside of bed doing some Tai Chi movements, working on my rock, my solid, simple Tai Chi movements, which also keeps me in the present moment. And then I go about my day and take my cold shower. So that's how I do it. Now I'd like to hear from you guys. And it's such an important topic. Okay. Oh, I see lots of good stuff here. All right. Can stress cause cognitive issues? Absolutely. Because let's face it, when you're clouded, when your brain is clouded, when you really are heavily stressed, how can you think clearly? I can't. I can't. So I have to let it go. I have to let the stress go, bring myself back in the present moment. And whether studies have done that, have shown that, I'm not quite sure. We'll have to look that up, but I wouldn't be surprised. Can you get chronic fatigue from stress? Absolutely. Absolutely. It'll absolutely. It just affects. Remember, you're using the wrong hormones. You're using epinephrine, norepinephrine, and cortisol. These are fight or flight hormones. You can't be fight or flighting all day long. You'll never make it. It will exhaust you. Believe me. You need the parasympathetic nervous system, which we'll probably talk about next time, about the vagus nerve. We're going to talk more about that and what we can do. But yes, it will clearly exhaust you. Okay. After years of poorly managed stress, I ended up with cancer, and I really think it was a major risk factor to development of stress. Absolutely. And I didn't mention this. Thank you for bringing that up. It's been shown that certain personalities are more prone to this one disease versus the other. So people with cancer, and this is generalizing, it's not across the board, tends to be people that just take it all in and they don't really let it out. They've learned to live with stress. Like I'm the opposite. Anybody knows me, I can be explosive. I guess I got the cardiac um, disease thing for me. But so cancer individuals often just take it in and they don't let it out, and it just boils from within. And that's actually more dangerous to me because they're not always aware of their stress. They just learn to live with it, and which is not a good thing. Which is why I really try to talk to my patients about getting it out, objectifying it, writing it, journaling. It's so important. That's a great question. I think it's really true. Okay. Do hallucinogenics like mushrooms and ketamine use separately? It's really funny you should ask that. Yes, we should think like mushrooms and ketamine were like really bad stuff. There's a resurgence now using these. There's ketamine clinics that are being set up. There's some in Los Angeles, and also therapeutic use of mushrooms. So I don't know much about them, and they're not used in doses that make you really, really crazy and stoned, but there certainly is a benefit with regard to stress, and I'd like to learn more about it. But there are people that are doing it now, so I think it's true. Are there any lab markers that detect chronic stress? You know, that's like I said before. How do you measure stress? How much stress, how much of a decrease in stress will lead to an improvement? And it can't be quantified. There isn't a marker for stress. We can look at neurotransmitters, and I do a lot of adrenal testing in my office at Heartwise, and so I can generally get an idea if a person has adrenal um, dysregulation, and that will give me a good idea of their stress. Also, I can do neurotransmitters and look at like norepinephrine and epinephrine. It's really kind of a clinical diagnosis. I mean, after a while, you can look at a person and say they're chronically depressed or clinically stressed. So you don't really have to do the markers, but those are the simple things, the neurotransmitters. Okay. What do you think about grounding? Oh, touching trees. I love it. I did a study with Dr. Stephen Sinatra, who unfortunately passed away a week ago. My mentor. Love the guy. He got me interested in grounding and earthing. And I did a study to see because you can actually decrease blood pressure by being in touch with the earth. And I do believe it's a stress reducer. When you're in touch with the earth, the soil, the sand, you're actually picking up electrons from the earth's surface, which helps to squelch free radicals, which are positively charged. So you have a negative and a positive, and then wipes it out. We know that there's anti-aging effects, anti-inflammatory effects. People that ground regularly or are grounded have better sleep, do better with sleep. It is calming. Yeah, it's a great thing. I used to do it weekly. I would go to the Palisades Park in Santa Monica, up top of the bluffs, right before my dance lesson and do it. Haven't done that in a while, but it's a great thing to do. Does stress increase weight problem? Absolutely. Like I said before, or like I alluded to, when you're really stressed, I mean, some people like overeat and they get fat, and other people like undereat, and and people are different. But yeah, what happens when you're stressed? Your brain is clouded, and you don't make wise choices, and all of a sudden you don't give a damn. So you eat whatever you want to eat, and things happen. So yes, I do think that is a definite result. Okay, I heard jumping on a trampoline daily helps stress and the parasympathetic nervous system. Yeah, that's called a rebounding. Um, and I don't do it myself, but a lot of people do it, and we're going to talk more about the parasympathetic sympathetic balance next time we meet, and I'll really give you some good examples. But I do believe rebounding has that positive effect. Does it increase weight gain? We talked about that. Is it better to nose breathe when sleeping? Absolutely. Okay, so I actually suggest people that are mouth breathers that you should tape your mouth seriously when you sleep, because breathing through your nose is actually more hygienic, because you have all these mechanisms in your nasal cavity that help to basically clean the air. You have filters, you have temperature regulators, and with the mouth, it's a freaking cesspool of germs. So it's actually more hygienic, and it also enhances recovery. If you're an athlete and you want to recover, nasal breathing is the way to go. So when I do my respiratory training with this thing called a spiral tiger, SPIROTIGER. I do it in infrared sauna. So already I'm working at 140 degrees, and I'm doing these heavy, intense breathing exercises, and it's it's always to the nose. So nasal breathing is definitely it's also called septal breathing. It's definitely a good way to go. Okay, I've been taking 200 milligrams of progesterone for the last 8 years. I just received my blood work, and my numbers are very low. 9 months before it was okay. Can stress deplete progesterone? Stress can deplete any hormone at all. But also, if you're looking at um, hormones, if you're on hormone replacement therapy, I really don't believe blood work is that effective. Okay, because it can be useful, it cannot be. So if you really want to see how you're doing, it's better to look at saliva and or urine. That's what I usually use to check on. Most of you heard of me. Most of you heard me in May for Women's Health Month. So I don't tend to look at blood. It can be misleading. It can be helpful, but then it can be totally off. But I do believe that stress will affect any hormone. It'll definitely decrease your testosterone. It will decrease your progesterone as well. Does CBD help with stress, anxiety in your life? Yeah, I think that's one of the a reason why it's so effective. It's also good for pain relief and for nausea related to chemotherapy. Um, there's a lot of effects of CBD, and I do think it's useful in stress reduction. When working with lifting weights, why is it better to follow a program than you do your own thing? Well, you can do your own thing as long as your own thing is organized. I don't just go into a gym and say, "Well, what am I going to do today?" I always have a plan. Now, I've been doing it for a very long time, and I compete it. So, um, doing your own thing is fine, but you need to have some kind of a plan. So that's just how I do it. Can you talk about nitric oxide? Well, it's not really the focus of today's talk. So I'm just going to mention nitric oxide is a vasodilator, so it can help dilate the arteries leading to your heart. It can also help your penis, improve uh, erectile function, and so forth. So I do believe there's a role about nitric oxide, but I'm glad you mentioned that. So I will have another program that goes more into detail into that. I just want to stick with the stress right now, but thanks for bringing that out. Let's see. I have my glasses on. See your moment here. Any favorite adaptation herbs for stress? Ashwagandha is great. Passion flower is good for sleep. I think ashwagandha is very good for stress. Um, and there's another adaptogen. Senior moment again. I can't remember which one I like besides ashwagandha, but yes, they're very useful. Um, Saffron can be good too. Yeah, thank you. You guys are great. Okay, let me see if I got my questions answered here. Uh, We talked about. I think we got it. Okay. So, folks, what we're going to do, we'll spend more time next time talking about this autonomic nervous system balance, because I think it's really important, because we need sympathetic and we need parasympathetic. We need both. The problem that I see is that most of us, myself included, are more in the sympathetic overdrive, and that leads to more fight or flight, and that leads to stress. So again, when I told you about the stress, it's because all these chemicals, these neurotransmitters, norepinephrine, epinephrine, cortisol, are being secreted, and they can be a detriment to our health. So it's all about knowing when to use what at a given period of time. And that's what we learn as being medical advocates. It's being in control, taking control. I would say it's like staying in the driver's seat when it comes to your health. So again, I love teaching people how to breathe and how to deal with stress, because it's something that's terribly ignored in the medical profession, and you don't have to live with it. You don't have to live with it. Okay, I think I got everything. So I'm going to thank you guys. I think we're okay. We have a few more minutes. It's just 7:26. So speak now. I just want doing a quick job to make sure I didn't lose anything. Let's see here. Okay, I think we got it all. All right. Thank you guys. I'm very thankful and grateful, rather, to have you join me tonight. We'll be again in 2 weeks. Um, and those of you that have been asking, the book will be launched after Labor Day. We decided it really wasn't a good idea to launch a book in the summer. So it'll be launched after Labor Day, and I'm really excited about it. We'll spend a lot of time talking about it, but I'm really looking forward to it. So it'll be after Labor Day, and believe me, you'll get plenty of announcements. Okay, thank you guys. Thank you so much, and we'll see you in a couple weeks. Okay, thank you, and good evening, and have a happy and safe July 4th. Thanks.